This is a brief description of anal fistula and the way we treat it. Basically, anal fistula, if I draw your attention to this drawing here, this is the colon, this is the opening, the anus. These are the two muscles that surrounds the anal canal. This is a cut, a vertical cut, so you can see the two muscles. This is called the internal sphincter. This is external sphincter. This is another muscle called the levator. Basically, the main problem in treating these anal fistulas that makes it complicated for most general surgeons, that fistulas, once they form, they start with a little infection at the dentate line. This is in one of the mucous glands present here. And the infection spreads and forms a little boil. It makes a little abscess. That abscess can actually penetrate only the skin and go outside and drain, and that we call subcutaneous fistula. It's simple, you drain it just like any other abscess. If this infection actually penetrates the internal sphincter, it could drain in this space here, and this is also simple, and it's called intersphincteric abscess because it drains in the space in between the two sphincters. And the treatment also with laser is very simple, and it's a 5 to 10 minutes procedure with a cure almost 100%. The problem starts when the infection doesn't open to the outside. It actually penetrates the external sphincter here, so the abscess becomes like this and enlarges until it opens to the skin in here. And this is called now a transsphincteric fistula or transsphincteric abscess. It penetrated both muscles. And any kind of intervention on it now will entail by necessity the risk of damaging the sphincter muscle. And that's where the role of the laser fiber treatment that we do comes in handy, because we can do it without actually cutting any of the skin or the muscles through using a laser fiber that will allow us to coagulate this fistula and close the internal opening by a special technique that we designed several years ago, and it works very well in this condition. This will allow us to do these cases under local anesthesia in few minutes with very high success rate. The details can be explained to the patient when we meet them, and depending on their condition, they may require an MRI to facilitate the design and the planning of their treatment, but most treatments are done in the way explained. Thank you.